Hi, everyone. It's Alex Savidge from KTVU Fox 2 News in the San Francisco Bay Area. Today, we are going to look at some of the trends we're seeing with the coronavirus outbreak. And to break down some of what we're seeing, we're joined now by Sudha Varadarajan. She is with the company Swell, based in San Francisco. Sudha, so nice to have you on. We appreciate you taking the time.
Thank you, Alex. It's very nice to be here, and good afternoon.
So let's start with this notion of flattening the curve, reducing, slowing the rate of spread of infections for the coronavirus. Here in the Bay Area, a lot of health experts have been looking at the numbers and saying it looks like we're at least close to flattening that curve and slowing things down. Is that what you're seeing as you analyze the data?
Thank you, Alex, for that question. I started looking at this data about 2 weeks back, and I believe I published the first article on Bay Area flattening the curve. And the numbers are very, very positive for the Bay Area. We've done remarkably well over the last 3 weeks since, physical distancing and shelter in place has been brought in. However, we are still growing. We are not yet at the point where there are fewer new cases being added. So let's look at what we expect. We expect, if we are truly successful, that new cases on a daily basis have to start trending down. That's when you peak. So you peak.
You plateaued at that point. Yeah.
You're plateaued, and then you start seeing fewer and fewer new cases. We haven't reached that mark yet. We have a slower growth rate. What I'm seeing is, and these are approximate numbers, that for every person who is infected in the Bay Area, we seem to be spreading it to approximately 2 individuals. Mm-hmm. We start to stop the spread when for every person who is infected, we infect fewer than 1. So potentially, for every 2, 1 more gets infected and so on. That's what we want to be seeing in order to say, look, we have really gotten a hold of this and it's coming down. So we're not there yet. So we haven't peaked. Peak is when that shift happens.
When do you expect the peak of this outbreak will happen? Again, staying here in the Bay Area for now.
Fair enough. So there are 2 different perspectives to this, and I am not the epidemiologist to tell you which one is the right perspective, but one perspective says, look, the minute you institute strict distancing, you automatically bring down the spread, right? Because now if I have the virus and I am distanced from everybody else, there is nobody I can spread it to. Mm-hmm. And this virus will die its death with me. That's the hope. And so then you have to look at, people say, look, from the time you actually institute strict distancing, depending on the time of incubation and the time of cure, maybe about 4, 6, 8 weeks. The numbers vary, but it's a matter of weeks. Bill Gates came on CNN the other day, and he put out a number of 10 weeks. I've seen 3 weeks. It's somewhere between 4 to 10 weeks from the time you institute strict distancing that you will, and somewhere in the middle of that, so probably around the 6th or 7th week mark, you will peak, and then it'll start to fall. So my expectation for the Bay Area is mid-April, hopefully, if we continue with strict distancing. If we don't, then this will go further.
Okay, so the Bay Area seems to be, the numbers in terms of the cases seem to be trending in the right direction. Again, we're not close to where we want to be yet, but we're trending in the right direction. How does that compare to other places? I know you even draw a distinction between how things are going in Southern California, and then obviously, you can bring some of these other places into this discussion as well. Obviously, New York City, we're seeing this exponential rise in the number of cases. How does the Bay Area compare to these other places?
So LA, when I took a look at LA, the numbers at this time, at this moment, LA seems to be on a steeper trajectory than New York. New York has reduced its rate of growth since it put its shelter in place.
Right.
But they start off at a much later time. If you look at the curves right now, LA is actually on a steeper growth path. What that means is if LA continues at the same pace as it is, and I'm not saying that it will, but if it does, then they are looking at potentially 2.2 million cases by the end of April in LA. And if you look at the percentage that can be seriously ill and all that, the numbers are on my site in my article. It's going to be 50,000 plus who are seriously ill at that point in time, and that's a very serious, space to be.
Yeah. Sure.
And even if my concern is, even if you as a neighborhood and a community in the Bay Area, we do well, this is something that can only be fought by all communities fighting it well, because otherwise there's always going to be a risk of, a second wave and a third wave. And this is something that I think we as citizens of the world have to get together and fight as one population.
When you look at you compare the trends in terms of the growth in cases in California, let's say, compared to a place like New York City, in some sense, is it an unfair comparison? Because we're talking about a place like New York City, it's just so densely populated. Is it easier for a virus like this to spread in a place like that that's so densely populated, as opposed to California? It seems to me, just sort of as a layperson, it seems to me like we have a lot more room to spread out, to socially distance.
Yes. So that's a very interesting point. And I actually want to spend a minute on this. The reality of this infection is it spreads through, air, right? It comes through droplets from your respiratory system, through cough, through sneeze, through spit when you talk, and so on.
Right.
And the understanding so far has been that the max those droplets go is about 6 feet or 2 meters. Mm-hmm. And that's why the guidance has been physically distanced for at least 6 feet, right? That's the social distance minimum that we've been given. But a recent study has come out from MIT that shows that the max distance is actually 8 meters, not 2 meters. So the WHO is actually reconsidering its guidance of 6 feet, and that's happening. It's news that came out today. Okay. So density, when you bring up population density, so imagine I cough somebody 8 meters away who's, could potentially get infected. 8 meters is a long distance, actually.
That is a long.
So that's a long way. So then we come to not only do we have to seriously physically distance to ensure we have no exposure to somebody else's infection, where we have no choice. Let's say I am, the cashier at the local grocery, right? I have no choice. Then I come to, masks are really, I think, going to have to become everybody's, choice of how to protect their respiratory system.
Right. Okay. So you bring up masks, and it is an issue that it has come back to the forefront here, and I want to get your take on this. Not even that long ago, the White House put out a statement, and essentially now they are urging all Americans to wear either a mask or some type of face covering whenever they go out in public. I think a lot of people are confused, and rightly so. Early on, we were told by the federal health officials, don't wear masks. You don't need a mask. Save the mask for the healthcare workers. That part, I think a lot of people understand. But how did this turnaround happen here? Why all of a sudden are we now urging all Americans to not go out in public without a mask on?
Okay. So it's actually common sense, all right? The virus spreads a distance of anywhere between 2 and 8 meters through air. physical distancing that we are doing by sheltering in place is one way to not expose ourselves to somebody else's infection. But there is only so much we can do, right? We have to a very small extent at least, interact with the community.
Sure.
And in those situations, we have to protect our airways in order to not get put, and there could be people who are asymptomatic, right? People who have no signs of the disease, but they're carriers. Right. And they don't know they are carriers. It's our responsibility to protect ourselves so we don't spread it to somebody else also in the community. Now, when you look at masks, and I posted an article, I posted a link on my article. Yes, N95 is the most secure of masks in that 1 out of 100 droplets have the ability to reach you. So your reduction of, your security against in getting, infected is very high. But a homemade mask is not a bad idea. It depends on how porous your material is. And I just read today, Japan is urging people to wear 2 masks just in case it is porous, right? Mm-hmm. Just put one and then put another and then put a third layer and put a fourth layer. In some way, you reduce the porosity. You could just potentially do that. If you look at it, it's commonsensical that we apply layer after layer of protection around our mouth and nose. We significantly decrease the risk of getting infected.
Okay, so but I guess the question would be, why should the guidance from the federal government, from the CDC, from the White House, should the guidance have been from the get-go to have everybody wearing masks? Because most people have not been wearing masks here for the last few weeks. Would we be better off if the initial guidance was for everyone to wear masks?
I think what needs, irrespective of what was done, I think what public officials have to do is educate the public how this infection spreads and how they can protect themselves from this infection.
Yeah.
One is yes, just don't be in touch with anybody. That's been put in place now across almost the entire country. But the second is protect your airways. And if that is the mask, yes, if not before, at least from now, the guidance has to come in place that you have to protect your airways, especially now that it is known that the risk of travel is up to 8 meters. Protect your airway until a vaccine is found, until we know how to destroy this virus, until we have a drug. Let's protect our airways the best we can. I don't think there is anything wrong in asking people to do this because we are asking a lot of the public. This is a small thing to ask. And frankly, even if it is homemade, I think it's better than nothing.
All right. Yeah, no, and I think we're going to start to see a lot more people when they have to venture out, which, as you say, we all have to at some point or another. We have to buy groceries. We have to get food and supplies and things. We're going to start to see a lot more masks. I guess, I'm just had been curious about, why the guidance wasn't that early on. But you're right. From this point forward, it seems like that's probably the best bet is for everyone to cover up. Let me ask you, back to the data and what we can expect in terms of the number of cases. You talked about a second wave of the virus hitting. Is that if we don't continue are we going to see another wave of this virus, another couple of waves of the virus, no matter what we do, even if we continue to do social distancing and stay-at-home orders remain in effect? Is it just a foregone conclusion?
So the way we beat this virus is exactly by, the method I alluded to before, which is for every one person who gets the virus, there has to be less than one he or she spreads it to. That's the way we eradicate it. It's like eradicating smallpox, right? We have to just eradicate. We don't have a vaccine in this case, but we have to eradicate it from the community. For that, I think if we don't do that, it's gonna, the only way it stops is when it reaches 2/3 of the community. The science tells us that. If we don't eradicate it now when the numbers are small, then it will self-eradicate when it reaches about 70% of the population, because it'll have nobody to spread to, provided everybody got immunized or the body built up immunity.
Yeah.
So in order to make sure that we have nobody we can spread it to, we have to maintain extremely strict distancing for a long period of time of airways, whether that is by maintaining physical distance from people, by protecting our airways if we cannot maintain physical distance because we are in a, for whatever reasons, then by ensuring they protect their airways, we protect our airways, and we greatly reduce any transmission risk of this infection from person to person. And we have to beat this as a community, and as a community we have to fight it, because otherwise it's going to spread until it can spread no more. It doesn't care, right? It's going to try and spread as much as it can until it can no more. And so we have to ensure we are responsible citizens who are not carriers and who are not spreaders. And we may be asymptomatic carriers, we won't know. And we have to just be responsible. And I think everybody, if they take this responsibly and say, I'm going to do what I'm going to do to make sure I don't spread it to someone else, we can kill this super fast. It's, 8 to 10 weeks is not difficult if people start spreading amongst one another. They take it seriously.
Yeah. Well, I guess now that we've kind of done a few weeks of this, and we've got the hang of the work from home situation, which I'm sure you're doing and I'm doing. Yeah, you're right. I mean, now you look at 8 weeks and you think, okay, well, I can do that. I think early on, if you had asked anyone that or mentioned that a few weeks ago, people's heads would have exploded, just the notion of going that long. But now that we're in the midst of it, I suppose we can. I have another question that I'm curious about. When you talk about a place like the Bay Area, and the numbers showing us trending in the right direction, we issued stay-at-home orders and social distancing guidelines real early on, March 16th to be precise, for most of the Bay Area, far before any other places did so. And so if you have communities like this that are trending in the right direction, and then you have communities elsewhere in the country that are just now getting around to issuing stay-at-home guidelines, should we be limiting travel between those places within the United States in order to ensure that certain communities that are moving in the right direction continue to do so, and in other communities don't bring new infections?
Yes, you have to definitely ensure there is no spread across communities. I don't know how different governments will enforce this or be able to enforce this, frankly. But it only stops when everybody in the community is either walled away from people who are, others who are not taking, who are not able to control it, or it's gonna come back in a second wave or a third wave until 2/3 of the population gets self-immunized automatically.
Yeah. So I mean, it could make a difference, but whether we actually see those sorts of restrictions put in place, I guess, is another story. But it potentially would make a difference. Yeah.
It'll make a huge difference. Yes. Obviously, right? Anything and everything we can do to ensure we reduce the spread of this virus from carriers to those who are not infected will make a difference. But what those measures have to be, I think it's something that governments have to seriously ask themselves: how much are they willing to spend on this disease, on battling this disease? How long are they willing to battle it for? And if they say, look, we want this done quickly, then they're going to have to enforce extremely strict distancing in sync. This is where it is important. It is not enough that the Bay Area does it first, then Georgia does it second, then Texas does it third. Everybody has to get into this in sync, and the public have to cooperate. It cannot just be the government, right? The public have to cooperate. Everybody has to be in this together. Then we get rid of this in one shot.
Yeah, everyone does have to buy in. Let's end kind of on that point here with a final message from you about the public buying in to stay-at-home orders, social distancing guidelines, and keeping it up for the next 8 weeks, 10 weeks, whatever it turns out to be. I don't have to tell you, human nature is to let your guard down, right? At a certain point. How important is it for all of us to not let our guard down?
Extremely, because if this were not something microscopic, let us say if it was, some alien you could see, right? Then you would know that you going out would create two of those aliens, and in one of those horror movies, right? And then there would be 8 of those aliens,
Right.
and 16 of those aliens staring you in your face, and you don't want those aliens staring you in your face. So if we envision this, then we realize that in reality, the only way we ensure common sense, this thing spreads by contact. Let's minimize contact for a period of time, whatever that period of time is. And it can be very short if the entire community buys into it. Then we fight this together in one stretch. All those aliens just evaporate. They're done. They die, and that's it. We go out and we are back to normal. As a community, we need to fight this together. We have to buy into this together, and we will be out of it very quickly if we do that.
Yep, we have to we have to all work together, and yeah, that's it. It's the buy-in, and it's the long-term commitment to social distancing, which I
Yes.
think more and more of us are getting used to. It's tough. It's been tough, but we are getting used to it. We'll leave the conversation there. This was really a pleasure. I appreciate having you on, Sudha Varadarajan, who is the CEO of Swell, based in San Francisco. Really appreciate your insight here, analyzing the trends we're seeing with this outbreak, and what we can expect in the weeks and the months ahead. It's really been a pleasure. Thanks so much for having us on. We have more information for you at coronavirusnow.com. I'm Alex Savidge at KTVU in San Francisco. We'll talk to you soon.